Hey everyone, and welcome back to the channel. Today we are tackling a critical topic for your USMLE Step 1 and Step 2 CK exams. We'll be making a differential diagnosis of bleeding during pregnancy, so let's get started. First of all, let's look at the causes of bleeding based on when they occur. To differentiate the causes of bleeding, it's essential to consider their timing. So, if bleeding occurs during pregnancy, then ask yourself, is the bleeding painful? Painful bleeding will indicate abruption placenta, which is typically seen in the third trimester and can lead to serious complications like DIC, shock, and fetal distress. On the other hand, painless bleeding might be Placenta Previa or Vasa Previa. Placenta Previa is when the placenta covers the cervix, usually found in the third trimester, which is kind of high yield. But Vasa Previa involves fetal vessels that can rupture during labor, and hallmark of this pathology is that it leads to the fetal bradycardia. Okay, but what if the bleeding occurs after delivery? Well, you need to remember 4 T's to diagnose postpartum bleeding. Tone. This involves uterine atony, where the uterus fails to contract appropriately. Trauma. Any injury sustained during the delivery process. Thrombin, complication with the clotting factors, and any problems with the coagulation cascade, and most likely it will be a woman with the inherited coagulopathy in the questions. Also, there is last but not least cause, which called tissue. There are issues like retained placenta or abnormal placentations. So that's it, guys. Thank you for watching. Please consider to subscribe to the channel and leave a comment below. It will really encourage me to continue this channel. See you in the next one.